Neil Garver. I support our sales and growth team as a director of sales. It's a great alternative, and I think it depends upon if we're talking about a doctor who would want to work a few days a month or full-time. And I think there's a lot of benefits there, with obviously the fact that a hospital environment, a private practice environments where a lot of the anesthesiologists that we work with are part of, we provide a lot of flexibility. We can be really family-friendly hours, 7 a.m. to 3:30 p.m. roughly is a typical day. No on-calls, no nights or weekends. And so it's a real benefit to a lot of anesthesiologists. Plus we're seeing healthy patients, right? And when you're seeing a healthy patient, it certainly makes things a lot less complicated and a lot less difficult as well. Great for patients because we can hopefully help those patients get the care they need a lot sooner. When we look at some of the challenges that offices have now, especially with COVID and other issues in the hospital system, there's just long delays. Long delays to get a child, specifically the pediatric child, into a hospital environment. I think I've seen as long as 2-year delay for a patient to get into a children's hospital, and that's obviously a long, long time. So if we can hopefully see that patient within a few months, and not years, that's obviously a benefit for everybody, but it's certainly that child. It's great for practices for a number of reasons. One, it can certainly give them an alternative to a lack of access to an OR or ASC environment. Certainly with challenges in healthcare nowadays, a lot of hospitals are kicking out some of those elective procedures, and a lot of times those dental surgeries are considered an elective procedure. So there's very few alternatives for dental offices, for pediatric offices to be able to have alternatives that they can help, safely and see a healthy patient. And so, from a practice standpoint, it's one way to keep a patient in their office. It's one way to keep their staff in their office. It's one way to be able to help support and see more patients in an office-based environment because they have limitations to how long or how many patients they can see in a hospital environment. Obviously keeps revenue in the office too, so it's definitely a benefit for them too. But at the end of the day, it's breaking down those long wait times for patients to be able to get the care that they need, and certainly offices see huge benefit in that. SmileMD, accessible anesthesia anywhere.